Then coming to dysmenorrhea. What is dysmenorrhea? It is the pain during menstrual cycle. Okay. So what is the pathophysiology of dysmenorrhea? As we have discussed earlier, pathophysiology, I'll write it down. What is the pathophysiology? Pain occurs due to vasoconstriction of the spiral arterioles. Okay. And there is contraction of the myometrium. Uterine tone is increased and increase in pressure of the uterus. So why it occurs? It occurs when there is degeneration of endometrial cells during menstruation, leads to breakdown of endometrial cell layer, that leads to release of arachidonic acid. And that is converted into PGF2 alpha, that helps in vasoconstriction and increase in uterine pressure and tone, that leads to dysmenorrhea. So dysmenorrhea can be of two types, that is primary and secondary. Primary means it is physiological or spasmodic type, that occurs due to withdrawal of the progesterone and formation of the PGF2 alpha, that leads to vasoconstriction. So we will write the difference between primary and primary dysmenorrhea and secondary dysmenorrhea. Primary occurs when it is physiological and occurs due to PGF2 alpha, and secondary it is pathological, it occurs due to any underlying pelvic pathologies. Okay. Underlying pathologies, pelvic pathologies. What is the time when primary dysmenorrhea occurs? That is, it starts on day 1 of mens and lasts for 2 days. Okay, it may start on the day 1 of mens within 12 hours and it lasts for 2 days. And what about secondary dysmenorrhea? It appears 3 to 5 days before mens and not relieved completely even after starting of the menstrual cycle. Not relieved even after onset of mens. Okay. Then what is the cause? I have told you. What are the causes of secondary dysmenorrhea? All the pelvic pathologies like endometriosis, PID, or pelvic inflammatory disease, that is PID. Then any congenital malformation like biconvate uterus and fibroid uterus, cervical stenosis, cervical polyp or endometrial polyps, Okay, these are the pelvic pathologies for which secondary dysmenorrhea occurs. And primary dysmenorrhea is the important as it is related to ovulatory cycles. So all the ovulatory cycles are painful and anovulatory cycles are painless. So what will be the treatment? If we make the cycles anovulatory, then the primary dysmenorrhea will disappear. So what are the medications that make the cycles anovulatory? So in treatment we can give NSAIDs and occipils. Occipils makes the cycle anovulatory, hence painless. And for secondary dysmenorrhea, we need to treat the underlying cause. Treat the underlying cause. Okay. And what is the characteristic of pain in primary? Characteristic pain in primary dysmenorrhea, it is spasmodic type and confined to lower abdomen. Spasmodic type confined to lower abdomen. Does it radiate? Yes, it radiates to medial aspect of thigh. And what about the secondary dysmenorrhea? It does not radiate and it is deep seated pelvic pain because there is pathology, underlying pathology. So it is deep seated pelvic pain that occurs in front and back. So mostly it is anterior abdominal pain, lower abdominal pain, and there will be pain in the back and no radiation. Okay, front and back pain without radiation. Okay, so hope I made you understand all the concepts of menstrual cycle and dysmenorrhea. Keep learning. Thank you.